So radiation therapy is an important modality in the treatment of cancer along with surgery and chemotherapy. These are the three main important modalities. Sometimes they are used in combination. Sometimes you give only radiation. Sometimes you give radiation and chemo together before surgery, after surgery. It depends on what type of cancer we are dealing with, what is the age of the patient. Now I want to make something very clear that radiation being an important modality, a lot of people have a lot of fear about radiation. Before they come to us, they have lot many questions. So I want to very much clarify certain myths about radiation. Most important common factor which patients have in their mind is whether radiation is painful. Now, with the modern techniques that is available to us today, we are in a much better position to deliver treatment very precisely. We just try to conform the treatment to the cancer area, and we try to prevent the dose going into the surrounding normal structures. So, the normal structures or the normal functioning of the body does not get affected. It's a localized treatment, highly precise. So, pain, absolutely not. Yes, there will be certain side effects of radiation, as we call it, sequelae of radiation, but that depends on what site of the body we are treating. Suppose we are treating head and neck area, which is very common site, then definitely there will be lot of reaction in the mouth, usually appearing third to fourth week after radiation, but nothing to worry again. There is pain, but that pain can be managed, and it's a very temporary side effect. As the radiation is over, the patient start recovering again, and within normally 15 to 20 days or up to a month's time, the patient comes back to his normal self. So this is about pain. Also, another important myth about radiation is people are scared that after taking radiation, they will not be able to meet their friends, they will not be able to sit with their family. No, it is not like that. Radiation is nothing but exposure to very high doses of X-rays. Just like a patient undergoes a scan, CT or an X-ray and gets a very small exposure of X-ray, here the X-ray is of very high energy, but it's just an exposure. So patient receives the energy of the radiation in the form of X-rays and absorbs it, and that's it. Patient is not emitting any radiation. So as the patient goes out, patient is as safe as anybody else. So that myth has to be completely cleared. Third thing is, a lot of patients have misconception that along with radiation one cannot eat that, there is prohibition, not do this, nothing like that. We have patients who are taking treatment and even going to their office or doing work from office. So today, as I said, depending on the site of the disease and extent of the volume that we are treating, there will be side effects, but they are very much manageable. Other than that, there is nothing to worry about radiation. It's an important modality wherever required. If your oncologist is suggesting radiation to be taken, you have to follow it. Please don't shy away from taking this treatment, because that will hamper the results of the treatment and hamper the cure rate of cancer.